Hi guys, today we are going to see the topic diagnosis of pregnancy. So first, we will just revise some points regarding pregnancy. So what is menstrual age? It is also known as gestational age, and it is calculated from the first day of the last menstrual period, and it will come about 9 months and 7 days, and total if we are calculating the days, and would be 280 days and 40 weeks of duration. So you know about all these details. So we will go in detail about the diagnosis of pregnancy. So first, we will have to just see the pregnancy, the entire duration of pregnancy. The 14 weeks is divided into three trimesters. So trimester means it is for 3 months. So first 3 months will be coming under first trimester. Then middle 3 months will be coming under the second trimester, and rest 3 months will be the third trimester. So the first trimester it comes from the period of conception till the 12 weeks. Second trimester is from the 13 to 28 weeks. Third trimester is from 29 to 40 weeks. So these are the three trimesters for the duration of pregnancy. Now we will see the diagnosis for the first 12 weeks, that is for the first trimester. So you know that during pregnancy there will be cessation of menstruation. These are the symptoms. So cessation of menstruation. What is cessation of menstruation? That is amenorrhea, or it is missed period. So why it happens? Due to pregnancy, because as conception starts there will be increased production of estrogen and progesterone by the corpus luteum. So this will lead to the stoppage of menstruation. Okay, and but in some cases, a mother can experience a slight bleeding at the three within the 3 months, and it is known as Hartmann signs or placental sign. It will be very slight bleeding. Okay, that is known as Hartmann sign and placental sign. It is rarely seen in some women, and we should not get confused with threatened abortion also, because in threatened abortion also the mother will be having slight bleeding. So this is this here this threatened abortion, if it is not taken care, it can lead to many complications. Okay, inevitable abortion like that. Threatened abortion, if it is threatened abortion and we are early diagnosing it, so we can hear the progression here. The pregnancy can be successful, but if we are neglecting this symptom, so it can lead to abortion. That is other types of abortions like inevitable abortion. So the first symptom is cessation of menstruation, and it happens due to the hormonal influence, because during the pregnancy, estrogen and progesterone will be increased due to the influence of the corpus luteum. And in some women, in rare cases, there can be slight menstruation will be there in the first 3 months and very scanty. Next is morning sickness. You all are aware about this. In 50% of cases, we can see the morning sickness. Usually appears soon following the misperiod, nausea, vomiting, especially in the morning on rising from the bed. That's why it is known as morning sickness, and usually it disappears after the third month. And in some cases, it may continue till the delivery. Okay. Then next is frequency of maturation. Frequency of maturations. This is due to the congestion of bladder mucosa and irritation of the bladder by the pregnant uterus, because we know that in front of the uterus there is bladder. So as the uterus is enlarged due to the growing fetus, it will pressurize the bladder. So the mother may feel frequency of maturation. And due to the change in position, because growing fetus it make the uterus to change its position. Then due to the maternal osmoregulation, the mother may feel increased thirst and polyuria, and this also usually disappears after the third month, and this can for the mid trimester it will disappear, and then in the later stages of the pregnancy this may again reappear. Next is breast symptoms. Here the breast will be enlarged. Mother may feel heaviness, discomfort, and pricking sensation. 6 to 8 week. This symptoms will appear by 6 to 8 week, and especially these breast symptoms are especially seen in primigravida. and appetite changes. The mother may have craving for the certain types of food that is known as pica. Okay, so that, and even the mother, due to the psychological stress or anxiety, or because of the hormonal influence, mother may feel vomiting by seeing the food, or she may refuse the food. Then fatigue, frequent symptom that may occur this is the most frequent symptom that occur during the pregnancy, and mother may feel very sleepy. It is because it is due to the fatigue. So, what we discussed was symptom. Now we are seeing the objective sign. So, in the objective sign, that too we are seeing for the first trimester from the conception to the 12th week. So, in objective sign, in the breast sign, as we said, the breast signs are mainly it is evident in primigravida mothers. So, here it will appear by the 6 to 8 weeks. And what are the changes? First, the size will increase, and vascularity, blood supply will be increased. That's why we can see dilated veins, visible veins over the breast, and the nipple and primary areola will become hyperpigmented. Then slowly there will be the appearance of secondary areola. Around the primary areola, we will be able to see the secondary areola. And Montgomery's tubercles will be there. It is a sebaceous gland. So dilated sebaceous gland. And what is the function of Montgomery's tubercle? It keep because it is a sebaceous gland, so it will secrete sebum and will keep the nipple and the areola moist during the lactation. Then, as expression of colostrum, it is a thick yellowish secretion as early as 12th week. So, these are the breast signs what we can observe in mainly in primigravida. So, the size will be increased, vascularity will be increased, so the dilated veins will be visible, primary areola will become hyperpigmented, nipples will become hyperpigmented, secondary areola will be developed, Montgomery's tubercle will be evident, and colostrum will be expressed as early as 12th week. Now here you can see the Montgomery's tubercle. This is the small tubercles which become evident during the pregnancy. This is dilated sebaceous gland, and this sebaceous gland secretes sebum and will keep the surrounding part, that is the nipple and areola, moist. Now in abdomen we can observe, because by the 12th week, until 12th week, uterus will be a pelvic organ. So abdominally it won't be that much visible, but just by the 12th week, above the supra, that is above the symphysis pubis, a small bulge can be felt. That is because it has reached the symphysis pubis. So just above a suprapubic bulge can be seen per abdomen. Other than that, nothing can be seen till the 12th weeks, because still the uterus is in the pelvic cavity. Now then, pelvic changes: Jacquemus sign or Chadwick sign, Osiander sign, and Goodell sign. So this all the terms you are aware about this. All then in the later slides it will be explained to you. Jacquemus sign or Chadwick sign, Osiander sign, and Goodell sign. Now, what is Jacquemus sign? As we said, it is otherwise known as Chadwick sign. Here, what happens? The anterior vaginal wall and the vestibule. The change from pink color, it will change to purple color. That is known as Jacquemus sign, and it is visible at the 8th week. So, purple discoloration of vestibule and the anterior vaginal wall is known as Jacquemus sign or Chadwick sign, and it is visible at the 8th week. And as the pregnancy advances, it will be very visualized. It can be seen very clearly, and it is also present in multiparas also. And why the reason is due to the local vascular congestion. That is about the Jacquemus sign, otherwise known as Chadwick sign. And here the anterior vaginal wall as well as the vestibule color will change from pink color to the purple. So that is known as Jacquemus sign. It is seen at the 8th week, and even in the multipara it can be evident. Next is Osiander sign. Here what happens? There will increased pulsation is felt through the lateral fornix. This also visible at the 8th week. Pulsation at the lateral fornix. That is Osiander sign. Next is Goodell sign. In Goodell signs, the cervix will become soft. Softening of cervix is known as Goodell sign, and it is seen as early as 6th week. And the softening will be more at the external os and even at the upper part. And this pregnant cervix will be, while internal examination, the cervix will feel like lip of the mouth. On speculum examination in the cervix, we can visualize the bluish discoloration, and it is due to the increased vascularity. So, what is Goodell sign? It is a softening of, in simple term, we can say it as Goodell sign is the softening of cervix that happens during the pregnancy. Okay, so that is Goodell sign. So, we dealt about Jacquemus sign or Chadwick sign, then Osiander sign and Goodell sign. Next, the uterine sign. Here, the size will be enlarged, uterus will become soft, shape will be globular, and Hegar sign. In Eckhart sign, it is seen evident between 6 to 10 weeks. Here, what happens? Two fingers in the anterior fornix, the fingers of the other hand over the abdomen behind. So, what internally, two fingers will be inserted till the anterior fornix, and the other hand will be kept over the abdomen, and we will apply slight pressure. So, both the hands will be met together, abdominal hand as well as the internal hand. The fingers of both hands can be approximated as the lower part of the uterine body, and it will be soft and empty. That is Hegar sign. Then Palmer sign is during the bimanual examination, uterine contractions can be felt. That is Palmer sign. Next is immunological test. HCG test is done. That is, it is what is HCG? It is human chorionic gonadotropin. It is present in the maternal circulation. So, urine pregnancy test. So, through the urine, it is excreted. So, if we are checking the urine of the mother, we are doing this procedure. Human chorionic gonadotropin, because of the presence of this HCG hormone in the urine, so the color change will be happening. The band will be visible, and by that we can ensure that the mother is pregnant. And this is detectable in and even not only through urine, even the HCG will be present in the blood. That is, serum examination can also be done, and here just 8 days after the conception this can be done. Okay. And if diagnostic level in urine, it can be seen only after 23 or 24 days. Almost 1 month it may take, up to 23 to 24 days. But to detect, to find out the presence of HCG in serum, after conception, 55% of patients we can see within the 8 days. Okay, and this level, the HCG level, at the starting level, the present you can see in this graph. Here you can see 14th day, 15th day. So here you can see the level of HCG is slightly increasing. Then it is reaching to a peak level, and after that it will slightly fall. Okay, so that is the graph of HCG level in pregnancy. So here, if we are doing the urine pregnancy test or even serum HCG level, we can find out whether the mother is pregnant or not. And other blood tests for HCG are available. Even the blood test, usually it is done in bad obstetrical history, or if you are doubting ectopic pregnancy. In all that cases, blood test can be done, but most in majority of the cases, we are confirming the pregnancy through the urine test. Another human chorionic assays are used, that is radioimmunoassay, immunoradiometric assay, enzyme linked that is ELISA test, and fluoroimmunoassay. These all are done. Then through ultrasound also it can be detected. That is, by the 29 to 35 days of gestation, we can see the gestation sac. Then the fifth menstrual week, gestation sac as well as the yolk sac can be visible, and cardiac activities and fecal cord will be visible by the 6th week. Embryonic movements can be felt by the 7 weeks. Then, through the USG, heart rate can be felt by the 10th week. Now, next is the diagnosis in the second trimester, that is 13 to 28 weeks. Here, the symptom, the amenorrhea will be continuing. Morning sickness, it may reduce. As we said, it is most commonly seen in the first 3 months. So, the gradually it decreases, and even the urinary symptom will also decrease. Then, quickening is the most important thing. What is quickening? It is uh, mm, the mother herself, she will feel the she will feel the fetal movement, that is known as quickening. So in primary gravida it will be little late, that is 18 to 20 weeks, but in multipara more early, that is 16 to by 16 to 18 weeks that she can recognize the fetal movements. Then abdominal enlargement. Then in abdominal examination, in the second trimester, we can see the linea nigra. You can see a line that is extending from the symphysis pubis till the syphistern. This is known as linea nigra, and it will be evident, clearly evident by the 20th week. Okay. Then here you can see some stretch marks, stria, that is stria gravidarum, or we can say it as stretch marks. Okay, it can be pink and white color. It is visible in the lower abdomen and more towards the flank region. Here you can see the linear diagram. It will extend up to the syphisternum. In some cases, no, only up to the umbilicus, but in stria gravida it will be in the lower abdomen. In some cases, even it can be seen over the breast and even over the thighs. The striations can be visible during pregnancy. Then in palpation, the second trimester, as we said that abdominal enlargement will be there, so we can measure the fundal height. Okay, you know what is fundus? It is upper part of the uterus. So the fundal height can be measured. So so with the second trimester, slowly we can see that there will be enlargement of uterus. You can see by the 12th week, as we said, there will be suprapubic bulging by the 12th week here. Then afterwards, as the pregnancy advances, the uterus will be gradually enlarged. Okay. The fundal height can be measured in centimeters. So you know this from the symphysis pubis to the syphistern. Okay. Then uterus can be felt abdominally, it can be felt, and it will be ovoid in shape. Uterus will be soft and elastic because uterus has not started its contraction. So soft and elastic. Braxton Hicks contraction, that is painless contraction in will be detected by the abdominal examination, and the mother will feel fetal movements at the interval by placing the hand over the uterus as early as 20th week. External allotment can be visible, and the palpation of the fetal parts and palpation of fetal movements by the doctor, whoever the consultant, she can palpate the fetal parts at the 28 weeks. Okay, 20 weeks. Next, the second trimester auscultation can be done. The auscultation is done to check the fetal heart sound. So, auscultation of FHS can be done as early as 20 to 24 weeks by Pinard stethoscope. In the first trimester, we can fetal heart sound can be elicited by ultrasonography. But in second trimester, using the Pinard stethoscope, you are well aware about the Pinard stethoscope, so that can be used to check the fetal heart sound, and even auscultation the fetal shuffle sound, because through the umbilical artery there will be rush of blood, so shuffle sound will be felt. Even the uterine shuffle, while checking the fetal heart sound, we may misinterpret with this uterine shuffle. It is this murmur sound. Here, soft blowing and systolic murmur heard low down at the side of the uterus, and it is if we are trying to synchronize it with the maternal pulse, we will be able to synchronize it with the maternal pulse. It will be same uterine shuffle because of the flow of blood. Okay. Then investigation, here also sonography can be done, and then fetal organ anatomy, that is we are doing sonography. Okay, then fetal viability can be test, radiologic test. Then third trimester, the amenorrhea will be persisting, abdomen will enlarge, and it is enlarging more, so the mother may feel discomfort like dyspnea or respiratory distress or respiratory discomfort. She will feel palpitation or dyspnea. Okay, then lightening. What lightening here, it is a sense of we know that as the uterus, and we can see in this picture, I will show you. In this picture you can see the uterus is rising gradually. So when it reaches, you can see by the 40th weeks it reaches up to the level of syphisternum. Okay, by 38 weeks it will reach up to the level of syphisternum, and just above that there is diaphragm. You can see the diaphragm. So because of this, the mother may feel respiratory discomfort because the abdomen or uterus, that the uterus has reached up to this level. So mother may be feeling respiratory discomfort at the 30th week. But you can see this dotted line. You can see by the 40th week, the uterine height, fundal height is just, it is coming downwards. So the mother will feel relieved. This is known as lightening. Mother will feel very light. Before that, by 38th week, she felt very discomfort because of the compression of this uterus towards the diaphragm. But when it reaches by the 40 weeks, the lightening will occur and the mother will feel respiratory comfort. She will be relieved from this compression. Okay, that is known as lightening. So it is in 30th week the sense of release of the pressure symptoms due to the engagement of the president. Why this happens? Because the whatever the presentation, it is coming to the, it is entering into the pelvic cavity. That is, engagement is happening. So so this lightening is happening and mother will feel a sense of relief. Then frequency, as I said in the first trimester there will be frequency of maturation, but in the mid trimester it disappears. But again, the frequency of maturation will reappear at the third trimester, and the fetal movements will become more clear, more evident, become more pronounced. Then signs, all the skin changes, whatever we noticed in the first trimester as well as the second trimester, all the skin changes, that is cutaneous changes, will become more prominent by the third trimester, and the uterine shape will change from cylindrical to spherical beyond the 36th week, and the fundal height, we said, it will be between the umbilicus and sternum. At the 36th week or 38th week, it will reach up to the sternum, and then at the 40th week, it will be coming down due to the engagement of the present. It's known as a lightening that we discussed in the just previous slide. Okay. Then fundal height, that is upper border of the fundus can be located by the ulnar border of the left hand and the point is marked. So we are measuring the fundal height while doing the antenatal assessment. We are doing this. We are measuring the fundal height. Okay. So that is symphysis fundal height. The distance between the upper part of the symphysis pubis up to the point marked is measured in centimeter. After 24 weeks, the symphysis fundal height, that is SFH, in centimeter correspond to the number of weeks up to 36 weeks. And even Braxton Hicks contraction, painless contraction, it is more evident during the third trimester, and fetal movements are very easily felt. Then palpation is will be very identification has become much easier, and fetal heart sound can be heard very distinctly clearly. Sonography can be done, so through that sonography we will get the fetal parameters, anthropometric measure of the fetus, and even the amniotic fluid index we can measure to diagnose whether it is oligohydramnios or polyhydramnios, or the amniotic fluid is adequate or not. So this we can uh, see through the sonography. In the differential diagnosis, so whatever we discuss it, the diagnosis, it was diagnosis of pregnancy, but in some cases we may misinterpret with the pregnancy. That is differential diagnosis. Here, uterine fibroid, in this case also the abdomen will be enlarged, even the hormonal imbalances will be there. Cystic ovarian tumor, the mother may feel amenorrhea. Amenorrhea will be absent. Amenorrhea, firm, hard and positive sign may be present. Then in all these cases, hematometra. Hematometra means it is the collection of blood inside the uterus. That is hematometra, and even the distended urinary bladder. This can also be misinterpreted. So this can be managed by the catheterization, and then tubercular peritonitis. That is if it is cock infection, that is TB. So in that case is also we differential. It is also the differential diagnosis for the pregnancy. Then hematometra, and then distended urinary bladder. So in this case, by the catheterization this can be solved. The next is pseudocystic. It is condition in which the patient has all the signs and symptoms of pregnancy except for the confirmation of the presence of fetus. So there will not be the presence of fetus, but all the signs and symptoms of the pregnancy will be there. That is known as pseudocystis. Pseudo means it is false. The baby is not there inside the uterus, but all the signs and symptoms what we have discussed, it will be present for the mother. That is pseudocystis. So that is about the diagnosis of pregnancy. We said the pregnancy is entirely divided into three trimester: first, second, and third trimester. In each trimester, we have discussed about the symptoms and sign and what are the observed signs and symptoms. Okay, so that is about the signs and symptoms of pregnancy. That is about the diagnosis of pregnancy. So I think you understood about this topic. Okay, thank you.